88-year-old Barbara Welke is back to her normal activities. The great-grandmother of 13 has energy again to walk in her garden.
I can do just about anything I want to.
But that wasn't true a few months ago when Mrs. Welke's aortic heart valve was failing.
It comes on slowly. And I got weaker and weaker and, I was losing weight and just was feeling terrible.
For patients in frail health like Mrs. Welke, open heart surgery is often not possible. But now the FDA has approved a new catheter-based, minimally invasive procedure known as TAVR, Transcatheter Aortic Valve Replacement.
The really good news for people who cannot survive open heart surgery is that this gives them a tremendous opportunity or alternative to go forward and have their valve repaired.
TAVR surgery requires a large team of cardiac specialists. Access to the heart is from an artery in the leg. A catheter is advanced and the valve is positioned.
This procedure keeps the patient from going on the heart-lung machine, so the heart is not stopped. It's put in while the heart is still beating.
Once the new valve is in place, doctors use a balloon to deploy the replacement valve inside the old one. It can be a high-risk maneuver. The valve is made of the same material surgeons use in open heart surgery.
There's that moment where this is where we're going to put it, this is where we want it to sit, and we obviously want that to be precise.
You have to make sure that that device is very strategically oriented in the correct position. A little bit too low, and it can push back down into the left ventricle and be free and bouncing around in the left ventricle. A little bit too high, and it can fly out into the aorta.
Procedural complications for TAVR include risk of stroke and vascular complications. But for patients unable to have open heart surgery, TAVR effectively lowers overall mortality rates among these high-risk patients.
The stroke rate is a little higher, but again, we're talking about inoperable patients who otherwise would not have a choice of life. And so the stroke rate, while it's a little bit higher, still we feel is acceptable.
Doctors say the new 90-minute procedure, which is faster than 4-hour open heart surgery, means less infection, less blood loss, and a faster recovery. For Mrs. Welke, that's just fine.
You have to accept it. I'll take whatever time I can get, to be with my family and watch my great-grandchildren grow up and graduate from high school and do whatever else it takes.
In Seattle, this is Mark Christopher.